Dear Chairman, dear colleagues, it is really my pleasure and honor to be invited to give this talk on prevention, early detection, and treatment of cancers caused by bacteria and viruses in the Asian Pacific region. There are three major cancers caused by infectious agents in the Asian Pacific region, including liver cancer caused by hepatitis B virus, HBV, and hepatitis C virus, HCV. Stomach cancer caused by Helicobacter pylori, HP, and cervical cancer caused by human papillomavirus, HPV. This slide shows the age-adjusted liver cancer incidence rate, which is highest in the Asian Pacific regions, including the China, Japan, Korea, Taiwan, and some Southeast Asian countries. Countries with a high incidence of liver cancer also have high prevalence of chronic hepatitis C infection and chronic hepatitis B infection. There was a significant increase in global death rate from liver cancer and cirrhosis from 1990 to 2013 in the world. The increase was especially striking for liver cancer related to hepatitis B and hepatitis C, showing a median percentage change of 52% for HBV and 291% for HCV. World Health Organization have proposed 6 target areas for the global elimination of HBV and HCV by 2030. Taiwan has launched HBV immunization program in 1984 and the blood safety and injection safety program in 1980 and harm reduction program in 2000 and the diagnosis and treatment of HBV and HCV patients in 2003. And as you can see on this slide, the immunization rate from 1984 already been around 90%, and it's remained very high from 1984 to 2016. The significant reduction in liver cancer incidence in immunized children was first documented in 1997. Liver cancer incidence rate per 100,000 was 0.52 for unimmunized birth cohorts and 0.13 for immunized birth cohort, showing a 75% reduction. Mortality and incidence rate of liver cancer in all age groups from 5 to 9 to 30 to 34 years old were much lower among the immunized birth cohort, shown in broken line, than unimmunized birth cohort, shown in solid line for both males and females. This slide shows the chronic hepatitis B and C patients newly treated with antivirals in Taiwan from 2003 to 2020. And as you can see, the number of chronic hepatitis B and C patients treated with antivirals increased gradually from 2001 to 2009 and then leveled off after 2010. And for the hepatitis C treatment after year 2017, DAA were used for the treatment. And this slide shows the association of nationwide hepatitis B vaccination and antiviral therapy program with end-stage liver cancer burden in Taiwan. And for the liver cancer mortality and incidence, as you can see here, there was a gradual decrease in liver cancer mortality after the launch of the hepatitis B vaccination program, and there's a further decrease in liver cancer mortality after the implementation of antiviral therapy for the chronic hepatitis B and C patients. This slide shows the changes in the chronic liver disease and cirrhosis mortality, HCC mortality, and HCC incidence over the period and cohorts in Taiwan. And compare with the reference period in 1999 to 2003, the HCC mortality and incidence in 2014 to 2018 had around a 50% reduction in liver cancer mortality and liver cancer incidence. And compare with the unimmunized cohort born in 1982 to 1986, those who were born in 2007 and 2011 have reduced the HCC mortality and incidence, showing around 60% reduction for mortality and 80% reduction for incidence. In Taiwan, we set up a national goal, try to cut cancer death rate in half. The goal is to reduce cancer mortality by at least 50% over the next 25 years, move more cancers from death to chronic diseases that people can live with, and create more supportive experience for patients and families. And it needs some prevention, screening, and early diagnosis and treatment of the cancer. And we try our best to use this methodology and try to cut the death rate in half. This slide shows the annual percentage change of liver cancer for both men and women in Taiwan. And after we implemented HBV immunization program in 1984, antiviral therapy program in 2003, and use of entecavir and tebivudin for the treatment of hepatitis B, and use of DAA for the treatment of HCV, and you can see the annual percentage changes showing a significant decrease in liver cancer mortality. Due to the prevention, screening, and treatment efforts, liver cancer mortality in Taiwan has begun to decline in the mid-2000s. Preventive measures, including comprehensive vaccination for hepatitis B and antiviral therapy for chronic hepatitis B and C, can accelerate the decline in liver cancer mortality. This slide shows that for men in Taiwan, the mortality of liver cancer will reach the 50% reduction in 2046, and for women, we can reach 50% reduction in liver cancer mortality in 2032. This slide shows age-standardized incidence rate of stomach cancer in East Asia, including China, Korea, Japan, Taiwan, and Vietnam. And in these countries, the Helicobacter pylori infection was also high. And we have published the Taipei Global Consensus Report on screening and eradication of Helicobacter pylori for gastric cancer prevention. And Helicobacter pylori infection is an important risk factor for gastric cancer in Asian Pacific region. And HP can be measured by endoscopy, carbon-13 urea-based serum antibodies, stool antigen, and so forth. And the drug efficacy may reach more than 90%. So it is considered that we can reduce the occurrence of gastric cancer by at least 80% through the control of Helicobacter pylori infection. So the screening for groups over the age of 50 is recommended. In Taiwan, we studied the antibiotic therapy of Helicobacter pylori infection in 2004. And after 2006, the number increased very rapidly. This slide shows the annual percent change of stomach cancer mortality of men and women in Taiwan. After the implementation of Helicobacter pylori therapy program in 1997 and the launch of Helicobacter pylori eradication program in year 2004, there's a gradual decrease in stomach cancer mortality. And our goal to reduce 50% of stomach cancer mortality in Taiwan by 2050 is through the Helicobacter pylori eradication program. And it is expected that we can reduce stomach cancer mortality at least by 50% over the next 20 years. And this slide shows that for men and women in Taiwan, it will take 19 and 20 years for us to reach the 50% reduction in stomach cancer mortality. This slide shows the estimated age-standardized incidence rate of cervical cancer in the world. And the cervical cancer incidence in Asian Pacific countries remained high in 2020. And in Taiwan, we started the cervical cancer screening program from 1995. The screening rate increased from around 10% to 81% cumulatively in 2016. This slide shows the secular trend of age-adjusted incidence and mortality rate of cervical cancer in Taiwan. After the implementation of cervical cancer screening program, the cervical cancer incidence rate increased slightly and then decreased very rapidly until 2016. And this is also true for the mortality rate of cervical cancer. It reduced from 10 per 100,000 to 3.3 per 100,000. World Health Organization has announced global cervical cancer elimination strategies in 2020, and it is urged that all nations has to implement human papillomavirus vaccination program for the girls at least 90%. APEC economies also announced the APEC roadmap to promote sustainable economic advancement for women through cervical cancer prevention and control in 2021 to 2025. And it is expected to accelerate and scale primary prevention of cervical cancer through HPV vaccination of eligible populations, with the aim to increase the routine HPV vaccination of girls by age 15 and introduce and/or increase the routine HPV vaccination of boys by age 15 and introduce and/or increase the catch-up HPV vaccination of adults. Based on the Taiwan experience, it is expected that the mortality rate of liver cancer in the Asian Pacific region can be cut in half through the HPV vaccination as well as the screening and antiviral therapy of eligible patients with chronic hepatitis B and hepatitis C. The mortality rate of stomach cancer in the Asia Pacific region can also be cut in half through the screening and antibiotic therapy of Helicobacter pylori. And the mortality rate of cervical cancer in the Asia Pacific region can be cut in half through the cervical cancer screening and HPV vaccination program. With that, I would like to thank you very much for your attention.